As the number of COVID-19 cases continues to rise, there are questions about readiness. Specifically, are Minnesota hospitals ready if there is a major outbreak here? Experts estimate that in a coronavirus outbreak, 80% of cases will be relatively mild, and patients can be treated on an outpatient basis and will recover at home. But 15% of cases would need hospitalization, and 5% would need treatment in intensive care. Joining us to talk about Minnesota hospitals' preparedness is the president of the Minnesota Hospital Association, Dr. Rahul Koranne. Thank you so much for coming in.
Thank you so much, Esme, for having me.
All right, let me ask you, we talked a little about this with Senator Smith. If I went to a hospital in the Twin Cities today and had just come back from China or Italy and said I suspected I might have it, the virus, would I get tested? Or could I get tested? Would they have the test there?
We're joining the Minnesota Department of Health in messaging to Minnesotans just like you to say, don't come in, call first. So call your primary care provider. We will guide and direct you along with the Minnesota Department of Health. If you need to be tested, Minnesota Department of Health will test you, and then we will make a plan from a public health standpoint to quarantine you.
So don't go to the emergency room, but do we have a lot of tests here in Minnesota, enough, in your view?
Well, I'm pleased that the Department of Health finally has testing available, but they're only at the MDH labs. The clinics and the EDs and the hospitals at this point do not. We hope to change that, but at this time, call before you come in.
One of the things you testified to this past week before the Minnesota House was you said that Minnesota has a total of 5,000 acute care beds and 500 ICU beds, and that on some days, just regular days, the availability less than 5%. That doesn't sound like we're ready.
Well, that's our usual way of operating. We're a highly efficient healthcare system. Inside the hospital, we typically run at 95% capacity, and that has been stressed with the seasonal flu. So the numbers I gave to the House and the Senate, less than 5% open ICU, med-surg, and isolation beds. That's why we are raising the concern right now.
All right. Well, it's a source of concern to somebody like me who's a layperson just hearing that. What's going to happen if there is a significant outbreak?
Well, I'm hoping that within the next week, the House and the Senate will respond. We'll think about creating an emergency preparedness fund specifically designated for clinics, emergency departments, hospitals, so that we can continue to prepare.
So you're saying that hospitals and clinics may need public subsidies. The Minnesota Senate is set to approve $20 million tomorrow in funding, but that's not for what you're talking about, right?
That's for public health. That's for the Department of Health. What we are concerned about is the limited capacity in the intensive care units and the medical surgical units, because we already have a lot of seasonal flu patients that we're caring for.
All right. It sounds as if the people who really are getting into trouble here, those people who, the 15% and the 5% that are in ICU, are people who are older and with underlying conditions. Is that still the case?
That is still the case. We are learning every day from the experience in China, in Washington. I just want to make sure that your viewers understand that we are preparing. We need some more resources to prepare. However, the Minnesota healthcare system is one of the very best in the country. So there's no reason to panic right now. We just want to make sure that the state legislators understand that.
And when we say older, what do you mean by older?
Well, again, there's no hard and fast. I see patients sometimes who are 105 and they're perfectly healthy. So there's no hard number. But 60, late 60s, 70s, 80s, just make sure you're doing what we do every winter. Wash your hands, stay at home if you're sick, drink a lot of fluids, and call your clinic before you come in.
Okay. Dr. Rahul Koranne, thank you so much for joining us. We really appreciate it.